is Dr. Geoffrey Mutuma. I come from the Zambezi Hospital. I'm the CEO and the founder of the hospital. And we are here today, 25th of February. We are doing the cancer walk, which we have been doing for the last 9 years. Cancer walk has been with us for the last 9 years. We normally do cancer walk in this day. Today we are in Mombasa. We are doing the cancer walk today in Mombasa. We are also in Thika. We are doing the cancer walk in Thika. We are also in Machakos. We are doing the cancer walk at the same time. So it's a cancer walk which we have been doing for 9 years now as a hospital. And this mainly to create awareness on cancer. February is a cancer awareness month, which actually we create awareness all over the world. It's not here in Kenya. 4th of February is World Cancer Day. And that's the day when actually we remember all the people with cancer. We remember all the people who have suffered from cancer. We remember all the people who have left us because of cancer. Because as we know, the most important thing of cancer we need to do in this country is actually to be able to create awareness so that people can come for treatment early. 90% of the people who have cancer now, they come at stage 4. And the main aim of this day is actually to create awareness on cancer so that we have the people coming to hospital as early as possible. The main cause of cancer, we don't know. And most of the cancer, we don't know what causes cancer at all. And we know the risk factors. And that's why we know that one of the risk factors of cancer is actually the diet which we eat, is lack of exercise, increase on weight. We have got smoking, and then we have got smoking, and then we have got alcohol, which we are taking too much nowadays, and other factors which increase the chances of getting cancer. What has happened is that we have got high increase on cancer now, and the cancer will continue increasing. Not only here in Kenya, mainly in Africa. We know that cancer is very common in developed countries, but because in Kenya we have developed, that's why we find that cancer is very common. Now, we normally have the schools which participate with us. We have got the companies which sponsor us, like we have got Mwalimu Sacco, which is sponsoring us for this year. We have got Kafoka, which has been with us for a long time. Actually, they sponsored every year, and we've got so many companies we have sponsored us. Last year, Safaricom was sponsoring us, and then we had East Africa, which was with that in last year. So we normally have companies which with us. Now, whatever we get from the cancer walk every year, we normally use 50% to create awareness, because awareness we prefer to be the most important thing we need to do, and we also use 20% to pay for the patients who cannot be able to afford for the cancer treatment, and then we use 20% to be able to do the screening, which actually we advise the people or the public to be able to do the screening, because the screening for cancer is the most important thing you need to do. Treatment is very important, but mainly screening is what you save lives. And 10% of the money we get from cancer, we normally use it for research, because we have given research very little money, because research is not very important for cancer control and prevention. What is very important, it is mainly the awareness, the screening, and of course the treatment. So you find that actually as a hospital, and of course as myself and Dr. Mutuma, I've done a lot of research in cancer, and I know what is very important, and this I did a long time, almost 25 years. I've been doing cancer research, and what I know is that actually where we are in Kenya, cancer will continue to be very common in Kenya, and what we can do is actually to create awareness. And more so, what's very important is that the young generation, that's the people between below 20 years now, even 30 years, most of those people will have cancer, because cancer will continue increasing with generation. The generation which was there around 60s, 70s, their cancer rates they were low. But as we develop, and more so as we eat more refined food and we increase our population, as we increase our development, we'll have more cancer. So cancer will continue to be common in this country, and they have said that cancer will be killing more people than all diseases combined, and that's by 2020. I thought 2020 is very far, but it's very near with us, and even up to this time, we know that cancer is killing more people. We've got our brothers, our sisters, our mothers who are left us because of cancer. So it's very important we create this awareness, and this will go very far when it comes to assisting to reduce the rates of cancer, and to get the cancer to be diagnosed very early, and treatment to come very early, because cancer is not painful. We don't know what causes cancer, and that's actually the major issue, which is very important with cancer currently.
Thank you, sir.
Is there a question?
So far, how many maybe patients have benefited from the works that you've done?
We have got almost over 100 patients who were benefited from our works, because we started our work in 2015, and we have been doing this every year. We have got almost over 100 patients who have benefited from our work money, which we have paid them for their cancer for their cancer treatment. But most of the patients actually who have benefited are the patients who are screened and discovered cancer before it is known. When the cancer is not painful, those have benefited a lot. And most of the people are benefited from the awareness, which we create awareness, and we normally create awareness in social media, in electrical media, and also in other media, because that's what's very important, because what we prefer that is to create awareness. And more so, what we have seen, of course, there's very little which we put in research, but we see in future, especially from this year, we need to put more on research to be able to fund people to do more research in Africa, because the knowledge we have about cancer is all coming from Western countries, because we have not done any research here in Kenya. Apart from knowing how many cancers we have in Kenya, we have not done any research. So, as a hospital, we will focus on putting more money on research in the future. But for this year and next year, most of our money will go to awareness, will go to screening, will go to treatment, and that will be our motto. And then what we are normally doing cancer works in 4 counties. We are looking forward from next year, even this year, to have at least half of the counties in this country we should be able to do the cancer works in more counties, even up to 10, because this year we want to do also in Meru, we want to do in Nakuru, and also we want to do in Loitoktok, and want to do also in Narok, at least to be able to cover more towns, more counties, because the awareness, and what we have seen for the last 9 years, is that awareness saves life, because we do this like today, and today there's a patient who will be diagnosed or be known to have cancer, because we are doing the screening here today. During the cancer work, it will be done in the hospital, which is in South Sea. In Machakos, we're also doing the screening now as they come for the work, and also in Mombasa, we are doing the screening and we do the work, and as we do the work today. So in fact that we have done a lot, and as the hospital, of course, we cannot be able to cover a lot. What we are asking is actually what we call the private and government partnership, so that we can be able at least to reach more people, because as a hospital we have tried our part and we have done our part very well, but we know that the few people we reach, they have benefited, but we prefer if more people can be able to benefit from this cancer work.
And actually, can anyone just walk in and come for screening?
As we do screening all the time, but during the cancer work today and for this week, we have been doing screening without charging. Not for free, because we are doing the screening for those who are wearing the t-shirts. When you have the t-shirt, you'll be screened. And the cancers we are screening for without charging for today and also the rest of the time is actually cancer of the breast, cancer of the cervix for women, cancer of the prostate for men. And then also something very important, which is actually not cancer, we're also checking for blood sugar and blood pressure, because those diseases are very common. The diseases which you have, the non-communicable diseases, that's mainly diabetes, hypertension, and cancer. They are becoming so common, and they will continue becoming common in this country. And that's why we want to create awareness. More so we are focusing on cancer, but we know we have so many people who are developing diabetes, they are developing hypertension very early in life. Yes.
Doctor, what is the biggest challenge when carrying these activities?
We have so many challenges. The first thing is that the acceptance of cancer work is not very much, because cancer, it has come soon. Yeah. It's not like heart disease, which have been for quite a long time. But nowadays, what we are finding is that actually most of our patients, they have cancer, not actually heart diseases or pneumonia or TB or HIV. Most of our brothers, most of our sisters, most of our children, actually, they will pass on because of cancer nowadays. So cancer will be killer number one. What we need to do is to create more awareness. What we need to do is to make sure that at least most people know about cancer. And cancer is different from the rest of the disease, because once you have it, actually it's not very easy. The cure rate and then the treatment is very expensive for the family, for the patient, and even for the government. The treatment for cancer is very expensive. And we can save a lot of money. We can save a lot of lives if we can only do the awareness. We can do the early diagnosis. We can do the early treatment. That is what will save life.
Okay. And you get some support from the government
Yes, not much up to this time. Of course, even in my research, I don't. The support from the sponsors or the donors, they don't concentrate very much on cancers because they concentrate mainly on infectious disease, not on cancers. So we have got a lot of support from infectious disease, but the support from for cancer is very minimal because, of course, the donors have got more cancers in their countries, so they don't need to know anything about cancer in Kenya, but they need to know more about infectious disease. So there's a lot of funding in infectious diseases, but there's no funding in cancer and more so in non-communicable disease. So for us as Kenyans, we have to sort ourselves. When it comes to research on cancer, we have to sort ourselves in terms of diagnosis. We have to sort ourselves in terms of treatment. Remember, when you have got TB, when you got HIV, the treatment is for free. And because it's already been funded by the government, it has been funded by the donors. But when it comes to cancer, ni wewe mwenyewe, ni wewe ndio unajitegemea. That's why we need to create awareness to see what we can do with cancer, because cancer is becoming very common. And the only thing we do is actually to create awareness, early treatment, and early diagnosis.
And your message to the local mwananchi there ambao hawajaelewa cancer vizuri.
Kwa vile naweza kusema kwa mwananchi ni kwamba ni mzuri tuhakikisha kwamba tumejua hali ya kansa, umejua hali yako wewe mwenyewe. Manake kansa, saratani vile iko ni mzuri kila mwananchi, manake kunajua saratani ina affect kila mtu, na ni mzuri kila mwananchi ajue hali yake ya kansa, hali yake ya saratani, sana saratani ya maini, saratani ya prostate, saratani ya cervix, saratani ya matiti. Hizo ndio saratani ziko kwa wingi sana, na kila mwananchi ni mzuri ajaribu vile awezavyo ajue hali yake ya saratani, na sisi kama hospitali tunawasaidia na vile tumeshafanya cancer walk, inakuwa rahisi sana kuja kwetu, tunaweza kukusaidia vile utajua hali yako ya cancer. Hata wale ambao wako na saratani na wanataka matibabu, wakituona tunaweza kuongea na wao na tuweza kuwaambia vile inakuwa sio gharama ya kutibu saratani iko ghali sana, na ni mzuri mwananchi ajue vile anaweza kusaidia na aweza kufanya nini ndio aweze kusaidika. Yeah.
In 1 minute, what can you tell the government in fight against cancer?
Yeah.
Just 1 minute.
About fighting about cancer, especially for the government, what we need to do is actually to increase the awareness of cancer. The way we have done awareness for the TB, the awareness for HIV, we need to do the same rate, the awareness for the cancer, because that is our new TB, that is our new malaria, that is our new HIV. So we need to create awareness, because that is what will assist us to be able to reduce the deaths on cancer. And more so, what we need to do, we need to increase, and the government needs to increase the support on the treatment for cancer, because most people who have got cancer, they cannot be able to afford. I know NHF has been trying, but we need to put more effort, especially when it comes to investigation like tests for cancer, X-rays, MRIs for cancer, and that test before the treatment. And also, the people going under chemotherapy and radiotherapy is be very important if we can get more funds, so that the local mwananchi, the local person, does not suffer when it comes to treatment, because the issue which we are doing very badly as a country is our country when it comes to treatment. And I'm sure some people who have got cancer, or even the families who had person with cancer, they know how expensive it is. They know how draining it is, the financial and also the resources, and even some people have sold their properties, they have sold their lands, they have sold their plots, they have sold everything they have in life. And what's very important is actually if we reduce the stage where the cancer diagnosis, it will make a total difference, and you save a lot of money and you save a lot of lives. Mwisho.
Yes, thank you.
Asante.